Very warm good morning, everyone. I hope you all are doing fine. Myself, Dr. Yamini Ramesh, and I welcome you on behalf of Asha Homeopathic Academy. And this is our eighth session of Revive the Basics 2.0. I'm really, really excited for today's session. But before we start, I want to tell you that the thought process behind starting this Revive the Basics. So, in day to day practice, we all are learning different concepts, tools, whether it is materia medica or repertory or some system or some method. But in doing that, sometimes it happens that we just do not brush our basics, the basic thing. So we thought that for practitioners as well as students, it would be really good if good clinicians, if good homeopaths come at one platform and share their experiences of clinical practice, which will be helpful for practical purpose in day-to-day life, in day-to-day OPD. It would be great. And with this thought, we started Revive the Basics. Earlier, we used to do the live sessions, the physical on offline sessions in our city. And in 2.0, we are doing the whole entire series online. And I'm really, really grateful to all the speakers who have come here, to all the teachers and practitioners who will come at this platform and share their learnings, because this is very, very important. This has given me a lot of inspiration, taught me a lot, and also improved my practice as well as my studies. So I'm really, really thankful. to, to all of them, and thankful to the audience who always come here and, give us suggestions, and we incorporate that. It's great. So welcome everyone. If you want to say anything, you can just write in the chat box, and I'll be really grateful to you. Anybody who wants to say something? Okay, so you can write in the chat box whenever you want to. Our today's speaker is here already. I was waiting for him, and I'm really excited for this session because I'm sure that I'm going to learn a lot. So I did not get much time to interact with Dr. Ranjan personally, but I always follow his social media tips and whatever videos he posts, and they are just amazing. He doesn't need any sort of introduction, but still, that is my job, so I'll do it. So just a second, we'll take Dr. Ranjan first, and then we'll start. Sir, good morning and most welcome. You're mute.
Thank you so much, ma'am, for inviting me. And this is always an honor and pleasure
Thank you.
to be
Thank you
associated.
so much. It's our pleasure and good fortune that you accepted the invitation and came here. Thank you so
No,
much.
it's my honor always. I've been following the works of Dr. Vaibhav and you since long time, and I learn a lot. And we met last year in my hometown also, and that
Yes.
was a great. And we learned a lot.
Yes, yes.
And
And since then, Vaibhav is your fan, and he keeps telling me that such a great work you are doing, your OPD and all the things. I mean, I felt FOMO that why I couldn't meet you, and only he met you.
same goes for me for the with Dr. Weber sir. I I was following him since long time with the agro homeopathy channel, but when I met him and I I understand his depth into the subject and his knowledge in the agro homeopathy. We all know homeopathy in human beings and animals, but in the plants and this in agricultural field, it is tremendous. And I can say that since he came to our village and in our town, there is marked difference, and people are noticing that yeah, homeopathy can also do in agriculture, and we are
Yes.
getting fantastic results. And day by day, the people will join. I assure Dr. Weber sir also, and doing a commendable job. I must
Thank
say, I must.
you. Thank you so much. I also feel that, when I see this aspect of homeopathy, I feel homeopathy is just magical because it's so useful for human beings, animals. I mean, we all have seen that we treat humans, and many doctors treat animals also very nicely with homeopathy, but with plants also. I mean, that also proves that homeopathy has huge potential, humongous potential. So
Wonderful.
that's really nice to see. So thank you so much. Thank you so much. So I just want to introduce Dr. Ranjan for all of you. Though most of you would know him, but some of his achievements are really remarkable, and we should know that. So he's a classical homeopath, practicing from close to a decade, from more than 10 years in Varud, which is in Maharashtra in India. And he graduated from Amravati with flying colors. He was a gold medalist in Nagpur's PGNAHI, and he completed his MD from a very prestigious institute, the Makkah of homeopathy, that is NIH, National Institute of Homeopathy, Kolkata, where he learned from many masters like Dr. Datta, Dr. Adhikari, Dr. Sunirmal Sarkar, who's also my teacher, Dr. LM Khan. He's a busy practitioner. He has a OPD of close to 100 patients, sometimes even more than that, and he works tirelessly from morning to night. He doesn't see the clock. He would just work, 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 and treat the patients. He's also trained under international homeopath Dr. Farooq Master. Recently, he has also given a seminar with Dr. Farooq Master, sir, in Mumbai. And he has been awarded with Young Achiever Award for his contribution in the field of homeopathy. If I'm not wrong, in 2020?
Yeah,
Yes,
2020. Yeah.
2020. He has also delivered many webinars and seminars on different subjects internationally, on national platforms as well, physically and on social media also. You might have seen some of his videos, and he's currently motivating and teaching many homeopaths through his cases from his channels on Instagram, Facebook. So I'm really grateful again, Dr. Ranjan. And today's topic is keynote. So I'm a student because I'm more of a repertory person. So it would be really nice to know some of the keynotes and use them in my practice. So all yours. Please start.
Can I share my presentation?
Yeah, yeah, please. Just a sec. Yeah, please try now.
Okay, so everything is visible and all clear now?
Yes, yes, it is
Yes.
visible. It's clear.
Yeah.
Please go ahead.
So the topic was allotted me or was chosen for me was the keynotes, the tool for the successful homeopathic practice. We all know that we use uh, something to cure patient. Something. I don't say that it is a keynote, it's a repertory, it's some themes, it's maybe mind or mental rubrics. We use something to cure, to to prescribe for the patient. The problem lies is which is more authentic, which is uh, more reliable, and which is more uh, in a way of we can produce it is in a multiple time. It can be repeatable. So for me, it was always and always keynotes. In my practice, we don't have much time to prescribe. Yes, we do a full case taking because my wife is also homeopath, and due to recent uh, uh, this expansion of our clinic, we have to we have some assistants also which make the case taking properly, but the time for prescribing is always short for me. And to see 100 and 100 plus patients, sometimes we need a um, a tool which is more uh, what we can say is which is more reliable, which is more uh, authentic, so that we can, when we prescribe, we are sure that result the patient is going to be cured or the patient is going to get results. And that for me is always keynotes. Uh, why Allen keynotes? Because uh, like many of us, I am also from the background where I did where we didn't have much exposure of homeopathy. I was not intended to do homeopathy um, because I was passed from a college where the teachers are also not believing in homeopathy. They also doing allopathic practices. They were teaching us half-heartedly. The teachers, some of the teachers were very good. Some of the many or and the maximum teachers we used to get, they are doing allopathy, and they himself they didn't have any confidence in homeopathy. So slowly, when I moved into my graduation, I realized that and some some things happen, and I moved on to the homeopathy. And when I went to Kolkata for my MD, I I found that I saw a different picture of homeopathy there. Patients are in queues. Patients are in bunches. Thousands of patients, 2,000, 2,000, 3,000 patients per day. We were seeing in National Institute of Homeopathy, and how to see them, how to prescribe uh, uh, um, for the patients. and how to justify, how to give justice to the patient in this short period of time. So I learned that many of the practitioners which were practicing there, they were using Allen keynotes. There in West Bengal, many almost every student of homeopathy, every practitioner, every layman, I also say a layman, who are those who practice in villages without any degree. They are just they learn homeopathy by reading only books which are translated in their local language, and they are also using Allen keynotes because they are most easy and most reliable to prescribe upon. Okay. Sometimes, when we used to see patients in National Institute of Homeopathy, a layman, or the any person would come, and the patient will say that he's one of the physician who prescribe homeopathic medicines in our town, in our village, where still there is no electricity, but that doctor, but that person has read uh, Allen keynotes and repertories and our organon in their from their local language books, and he will say, and he introduced to me, and he will say, and if you talk with that person, and you will understand that that layman has more knowledge of homeopathic subjects than us. And that happened many times. He will say that he will bring a patient, and he will say that, sir, I had given this. See this line. It is written in Kent, but it must be in Bangla. See, sir. See this line. It is in Allen keynotes. And I was to get astonished how they are doing this. But they are doing the very commendable job, because where still electricity was not there. I'm talking when I was maybe in 2011 or 12. Yes, that is scenario is still present in some villages of India, that no electricity till date was at that time, and they were doing it just with Allen keynotes, and they were uh, seeing almost hundreds of patients per day, hundreds of patients. Okay. So that's how I got into the journey of Allen keynotes. And when I went there, it was very new to me, because we were uh, in a aura of only in contemporary homeopathy, like those. We didn't read any the classical literature. It was very hard for us to get adjusted there. But when we started learning from our gurus like Dr. Adhikari sir, Dr. L.M. Khan sir, Dr. Surimal Sarkar sir, then slowly, I understand the importance of why Allen keynotes is important in your practice if you want to see major number of patients. And that's how the story goes. Okay. So why Allen keynotes? I will share you its importance. First, it is pure by source. If you see many of the Allen keynotes, the keynotes which are given in Allen's book, which can I say, are taken from Dr. Herring's guiding symptoms, and which are repeatedly confirmed. Dr. S.C. Allen didn't pick up the random symptoms. Okay, this is most important symptoms of Herring guiding symptoms, which has repeatedly confirmed, and then it is introduced by Dr. Uh, Allen in his book, which we call as Allen keynotes. Okay, so that is the important symptom. If you see why then Allen, why Herring guiding symptom is important, if you read Dr. Nair's biography, Dr. Nair's book, regarding Dr. Herring's biography, you can say that in the process of writing Herring guiding symptoms, Dr. He was writing a book which will Dr. Let me say that first, that Dr. Herring was a very passionate homeopath. We all know his dream was to create a encyclopedia where all the important symptom of a remedy was is included. It should be from proving, it should be from toxicological source, it should be from clinical confirmations also. So he was doing this. He had completed many volumes when he was alive. After he passed away, Dr. Nair took the work and uh, uh, completed it, and that's how we are having our hearing guiding center. That how much important it is, and Dr. Nair give an instance that one day Dr. Herring heard. We all know the story of lachesis, but I'm telling you that one day Dr. Herring heard that one patient is severely bitten by bees, honey bees, and he is in the deathbed, and doctor, it is some, maybe at that time it was some 100 or 200 kilometers away, miles away, it is written. But Dr. Herring took the pain to go to go to that person who was stung by bees, so, or the poisoned by bees. He took carefully the note of the symptoms, that whole edema was there, and was there. Hello, angioedema was there. Hello, yes. Angioedema was there. Patient is red. Patient has this whole shiny red swelling all over his body, and that's how the symptoms of angioedema and this red shiny swelling is came into the Matra Medica in homeopathy. Another example I want to give you, there was a doctor in somewhere in the other part of country who had who done the proving of gelsemium, if we know. And during this proving, he noted that when a person on that in that proving was exposed to any mental stress, like a bad news, or like any engagement, if or any work, if he has urgent work to do, the patient feels like he has to go to stool, the diarrhea symptoms will set in. And that was proved many times. Dr. Herring went to that man, he collected the symptoms, he inquired how you get that proving, how you done that proving, and how important that symptom is. And after confirming, he noted in his mathematics. And that's how the anticipatory diarrhea of gelsemium was came into our mathematics. So the symptoms which we are using, like they are very easy, or okay, that it is not that important, but they are included in our mathematica with utmost care, and with so much work, so much precision, so much experiments was done before including any symptoms. And from there, Dr. Allen pick up again the most useful, most verified symptoms, and he incorporated it in his it in a book, in a shape of book, which we called as Allen keynotes. Okay, so he's Dr. Henry Clay Allen, who was, if I will say a story, his works, we all know that he had written the keynotes of Mathematics with Nozodes, Mathematics of the Nozodes, Therapeutics of Intermittent Fever, Therapeutics of Fever, and Therapeutics of Tubercular Affections. How Dr. S.C. Allen was converted or was inspired to write Allen keynotes. If you all know that after the discovery of homeopathy, those who are joining uh, the homeopathic stream was mostly either they were laymen or they were physicians from the uh, allopathic side, we can say that. It is very hard for these people to understand and grasp the idea of individualization and prescribe on this symptom similarity. It was getting harder and harder to remember all these mathematica. So the easy way, which is still followed, is to prescribe multiple remedies for the given patient. So if a patient has diarrhea, if a patient has vomiting, if the patient has fever, give a five, 6, or 10 remedies sometime and see what happens. Because that's how they were taught. And same was the case with Dr. S.C. Allen. S.C. Allen was a polyprescriber. One day, when he was reading some uh, homeopathic literature, homeopathic journal, he had a paper where Dr. Lippe, Dr. Adolf Lippe, had um, written that if treated correctly or treated soon, the patient of diphtheria can be cured with one single medicine, and that too with a single dose. That astonished Dr. S.C. Allen. How this can be done? How how any physician can claim that he cure this such a devastating disease, such a serious condition, because diphtheria was a serious condition at that time. Serious condition with only one remedy, and that too with only one dose, mostly with one dose. So he went to meet Dr. Lippe. And Dr. Lippe said, "Don't sit with me. Let's go and we will treat the patient." So when it was rampant, it was a like a epidemic at that time of diphtheria nearby, where Dr. Lippe was practicing. And then Dr. S.C. Allen accompanied Dr. Lippe, and he went on seeing patients and patients and patients and patients and patients. And after at night he came, and next day again they went to that, then to the other areas. Then Dr. S.C. Allen inquired, "So can we go to the previous patients to inquire how they were doing after the medicine?" And Dr. Lippe replied, "No need. They all are fine." Dr. Allen questioned, "How can you say?" And he said, "I know, because we are giving him the right medicine." But Dr. S.C. Allen was not at all satisfied. He can't imagine how this can happen with one dose, how he can claim that the patient we were treating was getting better. So he went to the homes where previously visited by
Báo cho મારું વાવ હજી તો કેવડું ઉડું હતું હમણાં
Dr. Lippe.
સીડી ફરતા દે
Okay. So everyone, can you mute, please? Okay. So then after visiting all the patients treated by Dr. Lippe, he summarized his experience with 2 lines regarding diphtheria. Dr. S.C. Allen said, when, where Dr. Lippe reached before diphtheria in home where diphtheria is not till uh, is not getting the patient is not getting diphtheria, and Dr. Lippe was there, diphtheria never touched that patient. When Dr. Lippe was uh, in homes where diphtheria still didn't had affected any of the family members, and he gave the medicine, diphtheria never touched that patients. And when Lippe came in the house after the diphtheria has invaded, the diphtheria never progressed. That if Dr. Lippe has went to a house where already there are patients of diphtheria, he had given medicine and the diphtheria never progressed and the patient got cured eventually with the given medicine. And he wrote that most of the patients were cured by only one medicine. In some cases, they were the Dr. Lippe has to change the medicine after some time, but majority, above 90% of the patients were cured with single medicine. Then Dr. S.C. Allen got get enlightened, and he had his mind washed, brainwashed. He and after that he started studying homeopathy from Dr. Lippe. If you know, Dr. Lippe has a very uh, a good book, the keynote Black Letter Symptoms and Keynotes of Homeopathy. He also had a book, same Keynotes of Forma Medica, and that is the gem book if you want to read, where the majority of the symptoms were given which are proved and which are repeatedly verified. And with the base of that, with the and plus the gems, taking gems from the hearing guiding symptoms, he combined a book which is called as Keynotes of Matra Medica and Nosodes. So this is how the story goes, and that's how the the book Allen Keynote is uh, got into the shape. Okay. So how to read Allen Keynotes? To read Allen Keynotes, there is a certain way. Those who want to know how to read Allen Keynote, there is a certain method. I made a video. If you go on YouTube, search how to read Allen Keynotes with my name, and you will get the video and go through it. It is a 1.5 or 2 hours lecture where the method of reading Allen Keynotes was explained, how to understand Allen Keynotes in a better way rather than mugging the keynotes, how to approach the Allen keynotes with a systematic manner is explained. And you go there because it is if I keep explaining here, it take whole hour sessions. Okay, so it is already there in YouTube. You go and you read, understand, and listen from there. And if I but uh, but I can say that those who think that Allen keynotes is just a random collection of symptoms, it is not a random collection of symptoms. They are they are arranged in a manner like, are in a systematic manner. The first 2 lines were consist of majority of constitutions. Second 2 lines, there is the grand generals. Third, then the grand keynotes. Fourth, the particular symptoms with their particular modalities. That's how then the relationships is there. then the modalities, and then the relationship is given. So it is in a proper systematic way. And if you go through like that, then you will understand that how beautifully it is written, and that it is very easy to follow the Allen keynotes if you go in this manner. So please go to that video and see. So if you have your Allen keynotes with you, um, I hope that you have your Allen keynotes with you. So we'll go how we can use keynotes in our homeopathic practice. So many times the patient came to us with the acute complaints. Okay, we will search for remedies in the Mashra Medica, in the repertory. It is very cumbersome task. Rather than looking or asking the patient the few most important question for the prescription, we go in a haphazard way. Okay, this is my earnest request to have some criteria. Okay, for the acute cases, if you get an acute case, please have that criteria that if a fever case will come, I will proceed like this. If a cough case will come, I will proceed like this. So you have to have some questionnaire in your mind. The patient, after patient has done telling his symptoms, you ask what is the cause, how it is started, how it is progressing, what's your suffering, how you feel, how it get aggravated, how you get relief. If you incorporate your point in your case taking, it is very easy to prescribe sometimes in the acute cases also. So, for example, I have only two cases, but I will tell you other example also. I had a case of bad fever. The girl of almost 2 to 3 years of age, she was suffering from fever since 7 days. Since 7 days, doctor had done all the investigation. There was nothing wrong, but just the CRP was too high. It was almost 70, above 70. Normally 6. The patient has CRP above 70, and she was suffering from 7 days. All the antibiotics, the course of antibiotics was also given, and they were planning to shift her to the higher center, which is Nagpur, which is 100 kilometers from my place. So they said that you have to move the patient to higher center because the fever is not coming down. It keep on coming every 4 to 5 hours, and that too a very high grade fever. And they were not that much um, in that condition to go for the higher center. The patient was not that much eligible. Uh, so because one thing is that also the patient, the lady, the mother of the that girl was also pregnant. So it is very difficult to the family to admit a child with a pregnant mother, that too in a higher center where the cost of treatment may be in thousands or lakhs. They don't know. So they, in that desperation, they came to me, and when the patient entered, I took the patient was uh, uh, asleep. We I inquired some symptoms, and I took it, and I was not getting any remedy. Mm, Not if in these type of cases you have to be very sure with your remedy, because the disease has progressed into a certain level, so you can't get a chance of second chance sometimes. So uh, I was inquiring, and when the child got woke up, and I told that put her in a um, examination table, and as soon as she was got uh, put on my examination table, the light was came directly into her eyes. And he said, "No, I don't want to sit here. Please close the light. Please close the light." And that was one of the indication which I got. And the patients, and I asked her parent that did she didn't like the light in home also, because he just had wake up. I thought it may be due to his wake up, and he had everyone, they are our, just like they can't tolerate light for some time. But her parents said, since the fever had progressed, she doesn't want to look at to the light. Whenever we go outside, she will close her eyes, or she will hide behind something. She can't tolerate light. I examined her eyes, there was no infection, nothing, nothing, nothing. And on that, uh, I prescribed conium 200 in water doses. Okay. If you go through Allen keynotes in right hand side page, you will see photophobia, or in photophobia without actual inflammation of the eyes. If you see that there was no conjunctivitis, no redness, no any lacrimation, nothing was wrong with the eye. Still, the patient cannot tolerate the light. On that, I had given conium 200 repeated doses every 3 hourly, then followed by next day 4 hourly. To my utter surprise, the patient's uh, phone rang in the next day in the evening that since we started your medicine, the girl is not having another spike of fever, and now she's eating, she's more active, more conscious, and we will bring her tomorrow to your clinic. When the patient came, the girl was absolutely fine. Okay, so that's how we can use this Allen keynotes in regarding in treating cases of fever. Another case which I want to share is a case of uh, a patient who was suffering from cancer. He came to us, and uh, he was operated 1 or 2 years before for the CA prostate. Now the patient was suffering from high fever, 103, 104 degrees Celsius. And again, so he went to the doctor, oncologist who had operated him, and he done MRI and CTs, and they found that some lymph nodes are affected. Maybe the disease are it may be a secondary or a metastasis, but it is more likely. But there were abscesses near his pelvic areas in the deeper tissues, and the abscesses are very big, and the doctor suggested that we have to get a PET scan first, and maybe we have to drain it or we have to operate it. But first we have to bring down the fever. So they gave him a course of oral antibiotics. Still, the patient had didn't recover from the fever. The fever kept on coming every 3 4 hours, and it is of high grade. The patient got chills. Patient may become delirious sometimes, and it is going on. Then they decided to put the patient on IV antibiotics and higher antibiotics. The patient used to take a IV antibiotic course morning and evening. Still, the fever was there. It's the recent case, I say. The patient came to us and tell, sir, please can you do something? We go to I went through a report. and I just said, take patient pulse. I told my assistant, just count the patient's pulse. The patient's pulse was 130 plus. And I asked him, do you have fever right now? So said, I just have mine because I just took paracetamol uh 1.5 hours ago. And that maybe the patient, but the fever was maybe declining. We checked her fever, it was only 100 degree Fahrenheit. So if you go through pyrogen, we all know that septic focus plus the temperature and the pulse are not matching with the temperature. The pulse is not in parallel with the fever. So the fever was 100 degrees Celsius. Still, the patient is having pulse rate of 130. So on that, we started the patient on pyrogen 200 water doses. And the next day, he came that in my fever has got down and the spike was only at 8 p.m. and that too of only 100 degrees Celsius. And I didn't do paracetamol. It went down eventually at 10 or 12 a.m. at night. Next day, still I had that uh, spike at 8 p.m. Here, what we do that, oh no, patient still had fever, no, what to do? And it is kept on coming on the same hour. Let's switch it to Cedron. If you switch your remedy very rapidly, you will lose the patient many times. If the patient is progressing, then we inquire the patient that how's your appetite? How are you doing? How's your sleep? How's your vitals? He said, I'm feeling much better, doctor. I'm getting my sleep. I'm having my meals properly. I'm active and I feel very good. So we kept on. So we stick on pyrogen and we repeated again the doses of pyrogen, but on the larger interval. And on third day, when he came, he said, "Sir, no fever." On yesterday he came. It is a recent case. Yesterday he came, "Sir, since 2 days I'm not having fever. What to do now?" We suggested go get a PET scan, then we will see what we have to offer for you. So this how when their allopathy medicines are not doing anything, simple medicine like pyrogen, simple medicines can can do wonders. Where this modern medicine have no answer, sometimes our homeopathic medicines are do wonders. So if you see in Alan Keynotes, it is where everyone knows. So that's how we can use Allen keynotes in acute cases. For example, recently we are getting cases of eczema. We are getting eczemas. Okay. So when you ask, many new patients can come to uh, in our clinic and they are saying that, doctor, see, I'm having this uh, itching, this type of eczemas only in winter. Okay. So that when the winter starts, I start to scratch my body. There is so much itching, and these patches will appear from nowhere. And we think of graphitis and petroleum in soranum. But if you go through Allen keynotes, left-hand side page, in allosocotrina, you will see a beautiful line. Itch appears every winter. So we had many cases who will say that, sir, this complaint I only had in winter. Nothing. After that, I have it is very very good year after this winter. And if you go through Alan Kinos, you will see itch appears every winter. Whichever cases of skin, mostly they are with accompanied by the severe itching. If they are accompanied only in winter, please do not forget allosocotrina. We have cases after cases of allosocotrina. Once of one of my relative was suffering from the bad severe eczemas or in ankle region. The homeopaths they were consulted because they live far away from here. They gave him graphitis, petroleum, and soranum, and everything. They came to me and they said that it only comes in winter. Otherwise, the eczema is there. It will not itch. It will not have any problem. But as soon as the winter start, it keep on getting aggravating. The itching is so intolerable in these winter days. I gave her, my relative, a dose of allosocorina 200, one dose only, and the patient was complete better within no time. So it is an acute emergency in eczemas. Eczemas we can treat for a year, for a 2 year. This is no problem. But when they itch, we have to tackle it with very efficient. Otherwise, you can lose the case. Patient said that doctor, first you get my please get rid me of my itching. Then we can continue our treatment for a whole year. Plus, first you get relieve me with my itching. So if a case like this come to your OPD and say, "Thus, sir, winter lag gaya." Winter, as soon as the winter starts, I have to go. I have to go to the dermatologist. I have so much itching. I don't have to eat this. I don't have to eat that. I have to put many creams and moisturizers to keep so that the itch is not come. Please prescribe him a dose of allosopatina, and you will astonish that how wonderfully uh, uh, it it acts in it. We have cases after cases. So this is a power of using Allen keynotes. When you have a very busy OPD and you have to prescribe on just for a few symptoms, then Allen keynotes become very handy because they are verified. And these symptoms which are in it, they are mostly verified. Okay. If the topic of eczema came, and many, sorry to interrupt, but many students came to me and they said, "Sir, how to give this remedy? How to give this remedy?" They both look alike. Okay. For example, a tip to this winter season, many patients tell us, "Okay, sir, I have this chapped hands. Every winter they came. I have the skin eruptions. My fits and my soles get cracked, and and mostly we give petroleum graphitis. But if you know where to give graphitis and where not to give graphitis, if you see in graphitis, we say there is a moisture oozing from the eruptions. Yes, and the petroleum patient is have dry eczemas. But this is not the case with every skin disease which requires graphitis or petroleum. Sometimes they both look alike, like in chapped hands or the cracks of palm and soles. Okay. So if you go to petroleum, read first two lines. How is the patient of petroleum? You will see that the patient is quarrelsome. Patient is irritable. Like in bracket, they're given naxomica, ignitia. Rather than graphitis was indolent. Okay. So the main difference in graphitis and eczema, if you go on the mind level, it is the petroleum patient is like look like a Naxomica patient. Okay, the patient was irritable, angry, quarrelsome, and the patient will tell that doctor, I have this complaint of cracks on my palms and soles, the eczema on my palm and soles. Just prescribe petroleum, and you will see, you will wonder the results. Okay. So in Allen keynotes, that's important. That's how beautifully some constitutions are also given in very few lines. You do not need anything to prescribe petroleum in this type of cases. Anger of Naxomica plus skin symptoms is mostly petroleum. Okay. If you go to Sabadilla, we all know you prescribe Sabadilla for this allergic rhinitis, for our allergic complaints and hay fever. But if you want to prescribe Sabadilla to the patient constitutionally, please go through Allen keynotes, where first few lines, if you read that pale, delicate persons like phosphorus who desire sweet and warm. So, if you want to prescribe Sabadilla constitutionally, the patient's constitutional should be like phosphorus. Sometimes we give Ariarito, he's looking like phosphorus, he's so delicate, long eyelashes, tall, slender, and we give phosphorus to that patient and phosphorus didn't work because we have to look for the other symptoms also. So the same constitution, if you go through Sabadilla, first two lines, you will see that it is the same constitution as like phosphorus, plus the patient desires sweet and warm things, not cold things, as like in opposite of phosphorus. So this is the basic difference. We have to differentiate our remedies. If you go in the introduction on the preface, which is written by Dr. Allen Keynote or Dr. S.C. Allen in the book, he will say the constant work of a student of Materia Medica is differentiating and comparing of the remedies. That every student of Materia Medica, that's how we all are the students of Materia Medica, because our whole Materia Medica, I must say that Materia Medica is homeopathy. Homeopathy is Materia Medica. Homeopathy is not repertory. Homeopathy is not organ, and homeopathy is not philosophy. How homeopathy started? It started from the Materia Medica. Dr. Allen, Dr. Hahnemann got his idea from by translating Dr. Cullen's Materia Medica. How he mm, went to the went to discovering law of similus similibus current by proving and by noting the symptoms. After that, all this comes. So for us, Materia Medica is important. Materia Medica is homeopathy. Then how to apply the Materia Medica, how to practice it correctly, how to practice accordingly. It is given in organ. And how to be more approaching to Materia Medica, how to approach systematically or maybe in index form to Materia Medica. We have to help it with repertory. But the must thing to do in homeopathy, if you want to practice correct homeopathy, is to learn how to study and how to properly use our Materia Medica. Materia Medica is homeopathy. I say. Chronic disease. It is all the symptoms. We have to respect our symptoms. So that's how you can differentiate. That's what Dr. Henry S.C. Allen has wrote in his introduction. कि भाई के the student of mathematics should do only two things: compare and differentiate the remedies of mathematics. So the phosphorus looking like patient who had desire sweet and warm. The patient is not phosphorus, patient is sabadilla. And you prescribe sabadilla on this indication, you will get the curative result, not for the therapeutic result. Morning aggravation is there, patient is having uh, this sneezings and these symptoms of hay fever, give sabadilla. Sabadilla will may palliate the symptom. Again, after some time, patient will complain of this, or sometimes the sabadilla will not help. And the patient, when we will say, okay, can the sabadilla not work? No. But if you go through like this with constitution, with the desire and aversion, you will see that our medicine can cure, this small medicine can cure this disease completely, curatively. Okay, so that's how we will compare the medicine or the two remedies in our mathematics. Okay, are you with me? Anything? Okay. So next, moving to the chronic cases. These all are acute cases. We will go for chronic cases. Okay. Any difficulties up till now? Okay, we will move forward to chronic cases. So we'll have the clinic, the OPD of homeopathic doctor is 90% or filled with the chronic cases, 10% acute cases, 90% chronic cases. So if you have these chronic cases and if you have to justify your prescription and you have to produce a results within a short time, many times our classical literatures like Allen Keynote, not only Allen Keynotes, Boric, Clark, Nash, they are all handy in this type of chronic cases with the short period of time. Okay, because it is not based on any with, any observation only. Many of our contemporary mathematicas, many of our contemporary literatures, new age literature, we can say, they are all came from speculations. They are came from mostly from generalizations. But these, we can say, these literatures like Allen, like Boric, like Clark, like Kent, they are purely based on the experiences gathered. If you go in Boric and you read the his preface, Dr. William Boric, he said that the medicines, the indications which are gathered, which are written here, are gathered from the leading practitioner of that time, of that era. So he went on collecting all these symptoms which at that time the physicians were using, and that was verified hundred and thousands of time, and that's how he incorporated in his Mathematica. Same goes with the Allen keynotes. So that's why they became important, because you have to, if you want to a reliable source, it is these books which are most reliable in the treatment of chronic disease, because they are verified, they are repeated many times. So just go for so let's go for the chronic cases. So let's go for first case. We go from simple case to some pathological cases. So it is a simple case of warts. but the patient was suffering from so many months, maybe 7 or 8 months. And this was the ward. It was in middle finger since 2 years, and it was removed surgically 2 times. It was removed, but it went on keep coming. So the patient came to me कि सर इसका कुछ हो सकता है क्या? Can we do something with that? We removed it twice. Still it got coming, and it is getting bigger and bigger. So I took a case, and patient said uh, that, sir, uh, want I don't tolerate milk. Milk is intolerable for me. Okay, that was her case. And after the medicine, whole what went away, and it was like it was never there on the first place. The medicine we prescribed was simply natrum carb. If you go to the natrum carb, what's on palm of the hands? Natrum mure, dalcamara, anacardium, and patient. The the differentiating point was aversion of milk, intolerance of milk. In natrum carb, we will see that the patient cannot tolerate milk. Only on two keynotes we prescribe natrum carb 31 dose, one dose, and whole the wards went away. And still it may be 6 or 7 months since the patient got cured, and her family still visits me. She also visits me, but the wards not never uh, occurred again. So that's how simple it is. If you see wards on flat wards, Talcamara, cauliflower-like wards, Thuja. If you go in Sabina, the wards came and they itch very intolerably. Doctor, please do something that they see these wards are itching so much. Can you do something? What itching? Intolerable itching of wards. If you go in Sabina, you will see the intolerable itching of wards. So that's how we progress with our Matra Medica. Not every time Thuja will rescue. If you go to doctor, I will tell you uh, a case of Dr. Hanneman, which completely changed my practice regarding um, wards or other cases also. There was a student, Dr. Hartman, who was working after Dr. Hanneman, and he was assisting him since so many days. And one day, a very bad case of wards came to the OPD in the doctor in the OPD of Dr. Hanneman. And the patient had these huge wards, and Dr. Hanneman examined and gave him a remedy. And in the next visit, whole wards were gone. They all disappeared. And Dr. Hartman, who was doing assisting, and he got very astonished, and he asked Dr. Hanneman, "Sir, what medicine you gave?" And the answer was very typical, as and that's maybe from Dr. Hanneman, our teacher, that this answer we also get from our teachers, and that maybe that's from that Dr. Hanneman, our teachers, they learn this answer, that the answer was given by Dr. Samuel Hanneman was, you know the case, you tell me. And Dr. Harman again asked, no, sir, can you please tell me what you have given? And again, Dr. Hanneman said, you saw the case? You tell me. You know the medicine. But Dr. Uh, Hartman didn't able to think any remedy on the subject with by looking the case with the symptoms he had given. So what he did, he was so much restless. He's so much what Dr. Hahnemann had given, what Dr. Hahnemann had given. But he asked twice, thrice on several occasions, but Dr. Hahnemann never revealed the remedy. He told him, you know the case. You tell the remedy. And one day when Dr. Hahnemann was sleeping, Dr. Hartmann went to his OPD, took his patient register, go through that case, and the remedy given by Dr. Hahnemann in the case of what was chamomilla. So it is not that every time we have to go for the remedies like thuja, like sabina, like nitric acid, like dalkamara, like antin-fruit, like like lycopodium. But the more approach should be on the symptoms of the patient, not the pathology. If the symptoms are more characteristic, if the keynotes are more prominent, go with that. It sometimes happen that the patient didn't the it sometimes happen that the patient the remedy didn't have that pathology. But if the symptoms are there, you can go with the symptoms and you will see that the remedy will cure that case. That's how my whole understanding for uh, treating any disease has changed. That go first for the symptom. Okay. So next is the case which we can say is based on this uh, this understanding of Dr. Hahnemann. This is a case of molluscum contagiosum. Simple case of molluscum. The patient was suffering since so many time. Since 4 months, they went to some allopath. He given him some medicine, but they were reluctant to burn it. So 4-5 months had passed. These eruptions, these molluscums, they will keep on uh, increasing. They were first on the face, then they came to the neck, and they were spreading into the chest. And the patient were very worried. Yeah, how to treat them, and that's how some patient had maybe uh, referred that patient to me that please go there. Our child has same complaint and it got cured with homeopathy very beautifully without any burn, without any liquid action application like this. So when we go to the case, the patient had this molluscums started from the neck. The patient was thirsty and he required cold water. Hot patient. He also liked salt and sour. The mother said that he's very loquacious, but very destructive. He used to throw his toys. He used to cut um, uh, anything. He used to throw things in anger. He used to destroy things. He's very destructive. So on that, if you go on the right hand side page of Veratrum album, the remedy we gave was Veratrum album. Okay. So in right hand side, second or third line, you will see mania, cuts and tears, clothes and things. So the destructive nature is there. He also used to cut. If you get a scissor, he will cut. If he has this toys, he will break. And on the left hand side, if you see, it is given that on the below lines, you can see that the patient is having great thirst for cold water and desire for acids, where you see acid is sour things mostly, and refreshing things like fruits, like cold drinks. And on the first line, we will see the remedy for children's and old aged patients. So on this, we have given Veratrum album 203 doses And after some time, we repeated again because they were new, because of some complaint. And after I see 2 or 3 months, there is no sign of any molluscums. Okay, so that's how we can prescribe constitutionally with the help of keynotes. These are sour and refreshing thing, thirsty, hot patient, desire and mania to cut thing, throws thing, and mostly the remedy for children's. Okay, so if you go through our Matra Medica, that's how very well the constitutions are written. If you go to the anti-good first few line, for the people or the persons who go fat in the later stages of their life, they were not fat in their young age. Now they are getting fat. The patient will tell, sir, I'm used to be that lean and thin person, and now I'm put on so much weight. Please do, sir, something. The remedy we should click on your mind was first should be anti-inflammatory. If you have in graphitis, and the patient said, the doctor, I have this menses, they are not stopping, profuse menses I'm having, and these symptoms. And you ask the patient, when you started menstruating? Oh, doctor, I started menstruating very late in my uh, early age. Many my uh, friends, they start menstruating in 8th, and was I started menstruating in 11 or 12. If you go to the Allen keynotes left hand side page, in the method is written, women with uh, delayed first menses. In the ladies who had first menses delayed. All my friends who started menstruating, I started menstruating 2 years after that. Opposite, now we are getting many uh, cases of precocious puberties, and that matlab, I had a case I had many cases of girls who are start menstruating in their third or fourth standard, maybe 10 or 11 years of age, and that's too shocking to hear and to treat. Eventually, they will land in the in the cases of PCOD, in cases of menstrual irregularities, menorrhagia, like that. And when you inquire that if a 12 years, 13 or 14-year old girl start complaining of PCOD, how, when your first menses started? Sir, it started in my third or fourth standard. One of the probable medicine should be Sabina. We should see Sabina, second line, early first menses. When the patient has menses at very early age. In this, we can say precocious puberty. Oh, early puberty, not precocious, early puberty. Precocious puberty is delayed puberty. We can say that in graphitis, but where the menses are very early in the first life, Sabina is the medicine. You can treat, you will get many patients of Sabina. You will say same structure because Sabina is the same family of Thuja, that is conifery family. Patient will be fat, patient have these unwanted hairs in her face. Okay, desire to eat, um, loss of weakness is there. All the things of Thuja, unwanted hair, fat, fair, flabby, fat, flabby. But if you inquire very properly, you will get the symptom of Sabina that I started very early at menstruation at my very early age. And that's why many times Thuja, if you're looking for Thuja, you give Thuja, but it's not getting working. Please consider Sabina also. Okay. So next case, if you see how we can use Allen key notes in treating cases where we don't have much history. This is a case of diabetic ulcers, which was forwarded by me by my friend, one of my friend, and he told me that this has happened to that patient, and I am not getting any remedy. Can you please suggest some remedy? Yes. First, just tell me what is happening. He told me that patient had a diabetic history. He went for a walk. He went for a walk for some time, maybe 8 to 10 kilometers, and after that he came. He started. Then the fingers started getting swelling. They got abscess, and after that, the abscess was burst, and this ulceration was the ulcer came. Now he is on allopathic treatments. It's 2 or 3 months, and they were telling that it is a non-healing. It may be a case of non-healing ulcer, and it is not improving at all on the allopathic medicine. That's how they came to me. Can you suggest some remedy? So I went to Allen keynotes. If you see in Allen keynote, left hand side page, fourth, fifth line, you will see in carbolic acid, it is very well written. Physical exertion causes abscess in some parts. Okay. So with that keynote, and we all know carbolic acid is a very good uh, medicine for diabetes also, and this kind of ulcerations also. Where also we have cervicitis, where the liquor is very putrid, very profuse, like cervical ulceration, cervicitis, and where you find this remedy, this keynote, that physical exertion causes ulceration in the many parts, especially in the ear. It is especially the reference was given by R.T. Cooper, but you can apply it in other in the places also where we get this type of symptoms. So we prescribe him, and the patient is now gradually improving with the help of carbolic acid. Now, moving on to the causations, we have many time patients said that this is the exact. Many patients said that doctor, I had this my eyes got burned due to friction. Okay, my thighs got burned through friction when I walk and go this. Please do. Can you do something? Please give medicine for this. If you go to Alan Keynotes, if you go to Agnes Castus, you will see this type of symptom. Okay, after exertion, thighs getting this eruption, sore. If you give that medicine, patient, sir, it is completely gone away. So this is how we can prescribe very beautifully with these small indications. Now, this was a uh, moving on to the case. This was a case of erosive lichen planus. If you all see, the patient had COVID. After COVID, he had given many medicines, and due to this, whole his upper palate or the jaw, the hard palate was got ulcerated. It was very painful. Patient cannot eat anything. You can see some abscesses also there. See so much swelling, and the patient was referred by me one of in referred to me by some dentist, by one of the most busiest dentists in my town, and they said that we did everything and patient is not improving. Can you do something? Well, yes, sir. Just just refer me a case, just send the case to me. And I saw and took a photo and really got worried that how the page that um that I took a challenge, and now what will happen? I don't know. So I took the case, and the patient was starting There is a erosive lichen planus, which is diagnosed. Patient has this hard palate gums. It was itching, pustular eruption, swelling of the palate. Patient, the salivation was profuse. The patient cannot eat any hot thing, pungent thing. He has to. He was eating some bland diet, milk and bread like this. The patient was talking in very hurried manner. So, sir, I want this. I can't eat. I can't eat. I can't do it. So much salivation, so much pain. Can you please help me, doctor? When I was thirsty, hot, and there is a increased frequency of urination at night. Now we all know that if you go through Merck's Sol, left hand side with first line, it is written hasty and rapid talking. In bracket, we will see Hepar So simple Hepar ulceration of palate, night aggravation, hurried talking, salivation, we simply give Merksol. Merksol 4, 6, 8, we gradually keep on increasing. And after that, you can see the patient was 70-80% better. And I've sent that case again to that dentist for just only for examination. And we'll see that homeopathy can do wonders sometimes. It is magical that I was struggling in these cases and the patient was getting so much, that patient improved so beautifully. And then he started referring me cases after cases of lichen planus, then erosive lichen planus, then cases of what we can say leukoplakias, candidiasis. And that's simple on the few keynotes can help prescribe. There is nothing much in the case. If you see, it's not a long case because I didn't have that much time in my OPD to take case in very detail. So now that's how the patient improved, and still patient is still improving. Okay. So I will end my this topic to today's topic with the simple quote of Hahnemann, that when you have to do with an art, those with an art whose end whose end with a saving of human life, any neglect to make ourselves through master of it becomes the crime. That if you have this wonderful art, if you are practicing this wonderful art, and if you are not serious enough with your art, if you are not serious enough with your efforts, because it is related with human life, treating human life, making their pain go away. And if you're not serious, if you are not in uh, mindset of mastering it, it itself a crime. So if you want to practice homeopathy, practice like uh, your very life depends upon it. Don't practice like, no, ye kaam nahi karta, it does not work, this is not this is not everything is getting treated with homeopathy. Be have that attitude, have that what can I say, mindset that I have to master this art, because this art is, if we see that, it is very much uh, uh, easy, it is very much simple, and it is very much what can I say, can we can treat any case, or can help any patients of any pathology with our art. So please, those who are practicing homeopathy, please get serious. Read our first jo, our classical literatures, then you will see that how beautifully all these things are written. Okay. So thank you so much.
Thank you so much, sir. It was wonderful. I am really grateful to you. The insights which you shared and how to read Allen keynote and how to see keynotes and understand them and use it, and not only superficially, but as a constitutional remedy or as the minimum remedy through keynotes. It's just wonderful. I loved the session. Lot of things I have learned. So I have few questions which I received on YouTube and also here. So can I ask them?
Okay.
So one doctor is asking, what were the doses of carbolic acid?
We gave we we practice in water doses because Dr. Hahnemann in his later life after he shifted to Paris, he was working uh, with the water doses. That's how he went to got inventing the LM potencies. So what we do with we put a just a globule of uh, carbolic acid 30 potency in 100 ml of water with 2 strokes or 10 stroke according to the seriousness of condition or the gravity of situation. We repeat it. We gave it in 30 potency in 100 ml twice or thrice a day like this till the patient got improved, and then we stopped.
Okay, okay. Thank you so much. And also, if you can speak a little bit about how you go about potencies, like
But-
general criteria. I know it's a big topic, but still.
So there was simple understanding. If you say that Jhar's concentric circles,
Mm-hmm.
Dr. Jhar had given a concept of concentric circles where he said that we had last time we had a very good discussion on this, but that the when you potentize a remedy,
Mm-hmm.
neither his power nor his strength increases, but his area of penetration increases.
Okay.
What in our mind we mostly said that if you go higher, the medicine is more powerful.
Hmm.
This is not the case. If you go through organ, Dr. Hahnemann said in first few aphorism that every artificial morbific agent,
Hmm.
that's how Dr. Hahnemann used to call the allopathic or the homeopathic potentized remedies, that artificial morbific agents are always greater in strength than the natural chronic diseases.
Yes.
If you give in 3x potency, you will give in mother tincture. That's how Dr. Hahnemann started. He used to give the roots of bryonia.
Hmm.
Used to give, then he started giving in tincture form. Then he went to trituration. Then he went to diluting it. Why? Uh, what was his thinking? Because when he went on diluting and potentizing the medicine, he got the deeper aspect, the deeper penetration of the medicine, and that's how many symptoms were also getting cured, and the many symptoms will come.
Mm-hmm.
Okay, so it is basically if you go give 1 or 2 doses of doses of brine, the patient will get cured. There is nothing wrong, nothing with giving mother tincture and potency. But if you have a case which is require more penetration, where for examples, we have a case of simple diarrhea of Naxomica, where the patient said that, sir, I got tenesmus, I have to go to stool. After that, I feel better. Last night, I ate so many spicy and heavy food. That's how I get it. It is a simple case of Naxomica. You can give 6 and you can give 30, maybe. Okay. So when, and not any symptoms of, you're not getting any symptoms, other symptoms. Okay. So there you go with 6 or 30 potency, where because we have on only physical plane. Now, when we are getting deeper, now the patient said, maybe this is a case of ulcerative colitis, where you got the same symptom. That, sir, I have to get tenesmus, kuch ulta sida kha liya. I get this tenesmus, I have suffering from ulcerative colitis. If the stress comes, I do this, and then this ulcerative colitis patient say, I have to go to the stools with tenesmus. After stool, I feel better. Same symptom, but now the pathology is much more deeper. It is on the ulcerative, it is on the more deeper aspect. And now you are also getting, sir, I'm this angry person. I don't want any contradiction. I go into the quarrels like this. Now the area is deeper. So now go for 200, 1 m potency. Then it is a case of C rectum with the same symptom. The patient said, I'm this fastidious, I'm this quarrelsome, I'm this ambitious. Now we can get the whole picture. There you can give the higher potencies. Like Dr. Sarkar used to give, na, 10 m in water doses. We all know. Or Dr. Farooq Master practices in 5-cup method. But the potency will be high. So if you want to go to the deeper and deeper aspect, remember these jar concentric circles like that. If you are on the outer plane, start from 6, from 30, from 200, 1 m. How you go inside deeper and deeper, the pathology is getting deeper and deeper. You can prescribe on these principles. That's how, in simple way, it is given. Higher the susceptibility, higher the potency, lower the susceptibility, lower the potency. When you will have the lower susceptibility in the old ages, when there is a very much bigger pathologies are there, the susceptibility is very low. Patient cannot take the high potency. Start from low. Where there is high susceptibility, when the patient is having like the child, where is a in the acute cases, like where you get so much symptoms, then start on the high note. No problem. So this is a general rule for me.
Thank you. Thank you so much for sharing. It's a great insight because a lot of people are actually confused about potencies that, how to go about it and what to do, which one to pick. And like you said, this is a great insight that its penetration, its area increases and not.
It is. Yes. And
Yeah.
for I told each and every student of mine that for posology, don't think too much.
Mm.
The
Yes,
only
true.
yes, yes. The only thing which is controversial in homeopathy is its posology.
Yeah, true.
And it is the only thing which is not universal.
Yes,
Apart from the laws, apart from the mathematics, apart from the organon, reperties, all things, posology is something which is very much, we can say, is controversial and which is very, very individualistic.
yes.
They were,
Very
everyone,
experiential.
it's very exponential. They have their own things. So
Yes,
don't go from basic. When you understand, when you go, when you have some experience of 5-10 years, then go and develop this potency work best for me. This how that 3 doses, giving up 3 doses of medicine first, it is very good. Giving 1 dose is better. Giving LM is giving me more result. It's upon you.
yes,
Okay, so posology is something which I think that is more controversial. We are accepted everywhere with our laws and our mathematicas and everything. We are not accepted is all because of posology, because
yes,
it's dilutions and this potentization. So don't think much of that. Go with the basic book and what we have discussed here. This same is given in organ, and this is nothing new. So this is the basic to start from.
yes, yes. That's absolutely correct. Even my teacher, my first teacher, Dr. Dubey, used to say that if your remedy is correct, the potency is the least important thing. Whatever potency you have, you just give it. Just don't think much about it. And later, if you think that that one potency is not working and you're sure of the remedy, then you can change or you can, moderate the doses, potency, whatever, but don't think much about the potency.
That's how Ken had said. If the potency is better, has shown some effect, repeat
Yeah.
the potency at least twice, then move on to the next potency. Or if the potency, if you are some just like 200 potency and it has not worked at all, the medicine is not right.
Yes.
But
Yes.
we want to,
Absolutely.
अरे 200 में काम नहीं हो तो फिर 1 m देंगे, 10 m देंगे. It is not like if the
Mhm. It
your
should
potential
create
high,
something.
it should ignite something.
Yes.
That something is better, doctor sir. Okay, then go for that. It has been sir, no change, nothing happened. You give 10 m, then I will wait nothing. No,
Yes.
the medicine is not right, 100%.
Yeah, I also tell my students that they ask what is the best potency. I say the best potency is the potency which you have in your pharmacy. Don't worry
That,
about it.
that is correct. The best potency you have, which is available in your clinic.
It is available. Yeah, so don't think much about it. You have to be sure of the remedy first. That is the important thing. But yes, like Dr. Ranjan said, that this is also great insight that if any potency, whatever potency you give, if it doesn't create any effect, or then the medicine could be wrong. So this is an indication to retake the case or rethink about whatever you have done.
If you know Dr. Diwan Harishchandra and Dr. R.T. Cooper,
Yes.
they used to give single drop of mother tincture as a
Yes.
in a cancer cases,
Yes.
and they used to act on for months and for 2 months, 3 months, sometimes yeah, they have never repeated any in many cases कि भाई they have given one drop of mother tincture and after that nothing.
Yes. Yes.
Yeah.
Yes, and that worked. And even there are people who keeps repeating whether it is LM potency or plusing potency in centesimal, and that also works. So it is actually experiential, depends upon how you approach and based on what works for you. So don't think much about it. That is a great insight for me. Thank you so much, Dr. Ranjan. I'm really, really grateful for your time and valuable insights. I really enjoyed it. Thank you so much.
Thank
I hope everyone who is watching have learned at least something out of this session. And I could see one more question. Sir, how long to wait for the response after giving any remedy to change?
you. It is given in organ, and if you say that the when you administer a remedy, you will see the change in very first few hours in acute disease and in very first few weeks, 4 days, 7 days, 15 days, like that Dr. Hanneman has given is organ. Okay, so when you give a remedy, at least wait for 15 to 20 days. Okay, in chronic disease, or when you have given remedy in chronic disease, acute disease, just wait for 1 or 2 hours. Okay, don't, if something is happening, don't change the remedy, don't repeat the doses. Okay, it is all given in organ, and if you go through organ, it is always written. We don't read organ, we don't read our Matra Medica. That's why whatever knowledge we are having, this is we have our herd Matra Medica. Just like we have herd immunity, na? That someone is that one is having, so the other is not having, the other is not having. That's how there is herd immunity. This is herd Matra Medica. कि इसने ये बोला था, that is all going to pass कि भाई this is ऐसा रहता है. If you go through simple, I have said it many times this example कि if you have a patient like pulsatilla who is VP, who is has changeable mood, but who is somewhat arrogant and who is constipated, you just go and say in Alan Kennard, it is platina. In left hand side is written weeping tendency, changeable moods, all the simple, all the basic characters of pulsatilla, you will find in platina. But the platina patient is constipated. Whereas in pulsatilla, we have this normal 2 to 3 stools per day. It is written in boric. कि भाई ये 2-3 बार सर जाना ही पड़ता है हमको. These are the basic difference. But what we will say, अरे सर थर्सलेस है, अरे patient is weeping, अरे सर he is crying in front of me, सर ये हाँ. So now then we go to the repertory, irritable, pulsatilla is also irritable, pulsatilla is this also, this also. This is how when you have the general case, go for the generals. Okay, so we have this somewhat na okay, we have this herd knowledge, we have herd Matra Medica. This is herd Matra Medica is going through on generations and generations. Yeah, this is the basic picture. Is the basic picture. Lycopodium is like this, pattern like this. Now we are not having in my OPD we have at least one case of platina daily, or in week we will have 10 to 12 cases. If I ask how many of others are giving, sir, हमने तो पढ़ना देखा ही नहीं. कि we have 6 months में एक आता है this looked upon character, this haughty. No, if you see patient is irritable, angry, otherwise you don't have. If you go to stick to that only description which is in your mind, which was given by some authors, you to a seminar and you heard that you are not never going to prescribe platina. Platina is in the polycrest remedies, and how many times we are using it? We are overusing pulsatilla.
Yes.
We are using Naxomica. We are overusing our lycopodium, and that's why we are not getting the results.
Yes. Very true, very true. We are overusing few remedies just because I feel just because we know them, and also we are so well versed with few symptoms, not the all.
That we are heard, mostly heard.
Whatever we have heard, yes, yes, and which are keep repeating by our whether teachers or or colleagues, or we just see somewhere some reel or something. So that just keeps repeating. For example, like you said in pulsatilla and platina, very well said. I have seen that in CPA also, a lot of students tell me that, "अरे मैम, उसमें तो indifference ही नहीं था." I say indifference comes later. You have to read the CPA. It is like, it's written. It's like tuberculinum. It's like, a very irritable and very fast person. So that indifference is there, but that is not the only keynote or only thing in CPR. So in all the remedies, it is like that.
The patient, the same CPI patient loves dancing.
Yes, loves
They
dancing,
do that
sports.
dancing. Yes.
Yes. And then indifference will
So
come little late in life. That also you need to understand the evolution of the remedy, that how it goes.
that's why what I said, that if you stuck to the picture of high shamus, that patient is less severe,
Perseverance, yeah.
he's close, and then how will you prescribe high shamus in the cough cases?
True.
In winter, we have every day we will have 1 or 2 patients of high shamus. The sir
Yes,
cough start as soon as I'm going to lying down.
yes.
If you stick only to that picture, you even will never prescribe high shamus in acute cases like that.
And we
How
miss so many remedies like that. We just keep
much?
repeating the known ones, that 2030 only.
2030 is also, that too is not in that fullest potential.
Yeah, yeah, not at full potential. Yes,
Both, if my teacher, Dr. Adhikar sir, used to say, if you know your 2030 medicine by heart, you will know 100 medicine. Because in that differentiation,
yes,
in differentiating that 2030 remedies, you have to study 100 remedies.
yes,
That's how Dr. Nash has written the treatise on sulfur, where he had included almost 100 remedies that which are come close to sulfur in their symptoms. Red lips, you can also have tuberculinum. If, that is also in soranum. That's how you can correct. But in soranum, you have this symptom. Soranum person is most chilly, sulfur is more hot, sulfur is this, sulfur is that. So that's how they are differentiating. If you knowing sulfur, you will get to know at least 30 remedies in periphery of it.
yes. If we know it well and read from different aspects.
Different aspect onto the basic matra medicas. What the patient, what the most students will do now, they will stick to their memory and
Yes,
to the seminars and webinars and like that, but they don't go
yes, and
every.
confirm.
But this is not a fault of any author. This is not a fault of any teacher. Every teacher will say, I'm telling this. Please go and see in the books. If you go to the books, you will see. But we never go that. We will only stick to that picture. This has happened to Dr. Vittal Kaur also.
Mm.
When he was sitting in, he's had so many few books like Sally seminars he's having, and he was telling a bunch of people the case of pulsatilla, and he has prescribed pulsatilla on desire on heat of palm and soles, that yellow expectoration and hot patient, like that he has given pulsatilla patient, whatever. He said, sir, the but patient is not VP, patient is not that he will, and how can doctor, then Dr. Vitulka said, this is my fault, and I'm if you see that I have apologized for this in my previous seminar, but still I'm clearing here that the the remedy pictures like icopodium is like Mussolini and Naxumika, Hitler is like this one, Naxumika. So this is for the basic understanding of a persona.
Yeah,
This is not at all the picture of the remedy.
very,
If
very
you
nice.
stick to that, yeah, Dr. Vitulka himself has apologized. We have to look for the symptom first. Then
Mm.
it matches to that. Matches, we have to match on the mental or otherwise. If you got a characteristic, you prescribe on that. The results are bound to happen.
Very true, very true. Likewise, I have learned this from Dr. Shankaran also, because whenever he does a case, we also do that sometimes, that, sir, this is missing in this case, or that is not there. And he always says that it is in your mind that the remedy is like this. And you want to match that picture with the patient. I am sorry that the patient has not learned that, and he has come in. He always says that you shouldn't match what you know about the remedy with the patient, but you should match what patient has with the materia medica. So it's, opposite side. And we always, we many times do that.
Regarding Shankaran sir, na, there are so many stories are happening that, but what I understood now, if you go through his soul of Matra Medica, okay,
Yes.
when you see his introduction, one of the most important the page in any book is introduction. He said,
Introduction. True.
this is my observation, and
Yes.
this is subject to symptom which is I'm trying to elicit for the first time, that how patient will say,
Yes.
not how I we will see. Our mathematics is objective. Our mathematics is that we have to observe that this patient is like this, but how a patient will say to me, it is subjective matter. That is the soul of the remedy. That
Yes.
patient is talking his soul. Now you take this part, you match the below Fatak repertory indications, Fatak repertory mathematical references, which is he had also given in that book, but never, the students will not go there actually. They will not read that. They will not then read that medicine from Fatak, which
Yes.
is given very beautifully there, but they will stick to that part only. Oh no,
Yeah.
Ferrum,
And
yeah.
in one of his lectures, he also said, and I don't remember the book, but he has written also that I'm afraid to write the materia medica, because then people will have this impression that this remedy is like that, and they would match only that much.
In the same soul of remedies, in the same
Yes.
soul of remedies.
Yes.
This is he wrote that this is only the experience of Rajan. He has
Yes.
told that it is not of others. That's why I'm very hesitant to any mathematica, but this how happened. And that time he had given that one paragraph of any remedy. Below that he's giving references from Fatak
Yes,
mathematics.
the confirmations, rubrics, and
Yeah,
physical.
which he uses a lot, and then
Yes.
you see him uh, many times. I have attended sir's seminars, and he will just like I saw many my teachers of citing line by line of Alan. He will see he recite line by line of Fatak Mathematica.
Yes. Yes. Yes.
Go and see the so they are having basic matlab, they are also having their
Foundation very strong.
foundation, yeah, anything, anything, that's all. But we will not remember this. We will only remember that Ferrum, sir said Ferrum is like this. He is a second best person. He is a good secretary. Yeah. So only secretaries will used to get Ferrum now.
Yes.
Otherwise, the Ferrum is not going to be prescribed.
Yes.
That
Yes.
is the
Picky in that way.
yeah. We have to pick in that. What they are given, there is a one aspect which is missing. There are many gaps in our mathematics which has to be filled. Not not any remedy is not complete. Many remedies are still incomplete beside our the polykinase. So they are trying to fill the gaps. Like sister scan. Sister scan. What is sister scan? Sister scan, we will have these uh, crack and palms and soles, and we will have these cancerous nodules
And
also.
deserve perfection.
But where the mind of sister scan is given?
Hmm.
Never. But if you think in like this way, the sister scan is nothing but the rock rose.
Hmm.
It is used in batch flower, which is given for anxiety.
Yes.
The same anxiety of arsenic is we can found in rock rose. The arsenic-like patient, which have cracks on palm and soles, which have this cancerous nodule, which is chilly, now you can prescribe sister scan, where we used to prescribe arsenic.
Yes.
But arsenic is not that much useful in this glandular pathology.
Affection.
It
Yes.
is mostly the sister scan is where we need it.
Yes.
So this is how we have to fill the gaps in our mathematics. So these people are doing this, but what we are understanding now, we're only understanding only this picture
Yes.
that they're showing. They're showing go to the mathematica, learn in his book Spirit, first book Spirit of Homeopathy. He had recited so many books. Like if you want to study rubric, simply go to Dr. M.L. Agrawal's book.
Hmm.
He had never written a book of rubric.
Hmm.
He, he has gone that M.L. Agrawal is the best book. Go and study them. If you want to read more about this disease and delusion, you can go for Dr. Sehgal method, and then add my observation, then add my experience, and you will get more of it. But we never go to that. We will go to only search book and search. Yeah, anyone like Dr. Farooq Master sir, give this, then he will tell that अरे sir ऐसने बोला sir काम नहीं किया. अरे, this is not like that. Go and study that remedy from this source book, how they are going, get a background idea of that remedy, then you can add beautifully how this remedy works.
Very true, very true. Actually, we should become more, better students. I want to say that. And also, there is a saying, no, that the teacher never teaches, only student learns. So what we are learning is based on us and based on our understanding and our picky nature, but we should definitely confirm it from the source books, like you said. If we read source books, many of our delusions and, obstacles will go away, that oh, this is like that, this is like that. Hanuman has written extensively, and also other authors, so we have to go a step ahead of Hanuman and other authors as well. So we should not get stuck with that as well. We should definitely develop and add our experiences and learn from the contemporary people,
Yes.
from the previous masters. That is our job to do. We should actually learn the thought process rather than just the indications, few indications of the remedy.
I told my student, they ask me every time that which medical best,
Yes.
that which medical we read. Okay. So I tell them, everyone, that Mathematics is very individualistic subject.
Yes.
Every individual author has written according to their individuality, like they are. If you go for like Kent, you will have lectures. Those who are loquacious patients,
Yes.
those who are like more arsenic patient, who are very miser, like Boger, who are systematic, they have
Yeah.
written their in a very
Picky.
concise way,
Picky.
in a very concise, like Dr. Farrington, who are more inquisitive and research-oriented people, who have an analytical mind, like Aurum and Lycopodium, we can say. Then they have clinical mathematica. Okay, so first, uh, some many times you will attract to the mathematica which we are more similar with.
Yes.
Many
Yes.
people will say I'm very good at bowling, because you have that same mentality of arsenic, like neither you have to be very concise from the mathematical individualistic. So whatever your individuality, what is your constitution, if you are arsenic, find that way to where I find my arsenic like mathematica, and then stick to that.
Yes. Yes.
This
That's
is
so true. And even, homeopathy, I mean, the way you practice is also individualistic according to what you like and understand. So, and I feel that that is also a good aspect, because then, you get such type of patients, because you throw that universal energy. So
yes.
you get that type of patient, that type of practice, and then you can develop in that way.
Just like in aphorism number 5, where we got which is told by Dr. Hahnemann, that in the treatment of chronic disease, we have to find the most chronic cause, with the most important event in the whole history of chronic disease, plus the age, the factor, the environment, the class, the weather, the accessory symptoms, we can say. So in practice is also same. Where you are sitting, if you are sitting in a very
Yeah.
high polished area where they want to describe your personality in their all their sorrows, and they want to throw it out, you have to practice like that. There you cannot go and see, hey, what will happen, and they think, okay,
Yeah.
yeah, description and the always be from that source, but you have to be more patient with this patient, and where you have to sit in the villages or like this, we have to be more specific, because the patient is not time they don't have time to sit for 5 hours, 3 hours of case taking, 2 hours of analysis. No. So this is also very important. We didn't go with this.
Yeah.
So practice and is everything should be um, um, along with the your environment. It is all everything is written in the organ. I said,
Yeah.
if you want to treat patient, treat like that. If you want to treat, set up a clinic where I'm sitting, the people are there. The people are like this, me. So I have to use and choose this type of way. So you will just do this. But these books are never out of question in any practice. But you have to be more uh, uh, in that level with your patient.
Yes, yes. Very true. Even the writers, different writers, if you look at from the perspective of where they were, what was their continent, what was their time and atmosphere, even that way is also materia medica have changed. Like you said that, Kent was an American person and this hippie moment was going on. So it was, all here and there. So if you read lectures on Kent, it's like long lecture, very in a haywire way, I would say, not very systematic. But if you look at Bonninghausen or Boger, they were Europeans, and that methodical way of doing everything was there. Similarly, if you look at today's world, also you will see difference in that. But everything helps together. So recently, I was doing a research on for one of my paper. I was doing some work on lac remedies, mammal remedies, and I was going through all the books of whoever written the books on mammals. So I saw a lot of difference in the books of Massimo. He has written one book on mammals, and the experiences of Indian homeopaths. They were very different. But I could see from the perspective of the community he has. So he has proved few remedies. Different type of mindset was there, in his area. And Indian authors like Dr. Shankaran, Dr. Joshi, Dr. Dinesh, and whoever, Dr. Ghansham Kalathia. So different type of materia medica was there, but not very different. But yes, the language was different, the words chosen was different. So we have to think in that way as well.
Yes, yes. That's why we have okay, the first few literatures are written on the only the provings,
Yes.
symptoms, their conformations, their toxicological source, which are still uh, true to this date. That's like Alan Kennedy, it's like boring. The other contemporary literature was written according to the situations. If you see Dr. Paschero, he will have that old hippie movements like patients used to. They at that time the very scenarios was very different.
True.
Yeah, if you see in Dr. Vithal Kas's lecture, he has given his all lecturing that in 80s that at that time the crisis and the manifestation of the patients were very different. So if you stick to the physicals and the most classical symptoms, then you go and you add on your symptomology with this type of variations you are facing in your clinic, then you can easily cope with that. Now, if we were in BHMS, so I was in 2000 batch, I passed in 2010. How many PCOD patients were there?
Yeah, very true.
In gynecology, we have this short paragraph of PCOD that this happens. This is one of the condition. Once in the month, the patient will used to land. Now we will see every other girl is having.
Yeah, every second girl or third girl is having PCOD.
So this PCOD is not written in our homeopathic mathematics.
Yes.
Only the symptoms of disease has written in our mathematics.
Yeah.
In sub and I said. So you have to put on that like just like ADHD and autism. If you see how many ADHD and autism symptoms are there, but if you read, it is like mania. In mania, you will see now so many symptoms of ADHD and autism are given. The patient is to cut this varietal multiple. One patient came to me and patient said that he used to mimic all the voices of animals. He will see and he'll mimic the animals of cat and like that. And he's ADHD patient. So simple. Mania, mimic. It is rubric that mimicking, imitating, mimics the voices of animals. Stramonium is the remedy.
Wow.
Fear of dark is also there. So on 2 points a week of stamina, patient is better. Patient is start talking. Patient is more stable. Very simple. If you go like this now, the mathematica and the report is very easy.
Yes. Yes. We should know the differences, the confirmations, and like you said, we should read it from the source books and properly. There is a way of reading. It is not haphazard. So if you know that, if you can read in between the lines, you will understand materia medica like anything. And like Dr. Ranjan said, homeopathy is materia medica. Absolutely correct. It should come from materia medica. We confirm, even if we are going to repertory, we will confirm from materia medica only. So if your materia medica is strong, your foundation is strong, the chances of going wrong are very, very less.
That's how Dr. Uh, I attended, Dr. Farooq Masud also said this, and I attended Dr. Rajan Shankaran sir's webinar or seminar on repertoire learned desire to be. I don't know
Mm-hmm.
if it's there or
Yes.
not. I came all the way to Kolkata to learn from sir, and he said that के पेशेंट सर मोटा सोटा है, चिल्ली है, थोड़ा सा उसको ठंडी खांसी जल्दी होता है, मेरे को कैलकुलेटर लगा, मैंने कैलकुलेटर दे दिया.
Hmm.
This is a absolute formula of failure.
Failure. Yes, it is.
If you
So,
say and if you go through this repertory and then Matra Medica, then you're through all his symptoms. It is a more correct way. It is more harder way, but it's a more correct way to prescribe it. Where at that time first in my lifetime I heard Dr. Rajesh Shankar sir talking only on classical homeopathy.
hmm.
What we used to learn from sir is only contemporary homeopathy, sensations and kingdoms and miasm and like that. But the person who is so much into this and who is talking so fluently on the classical homeopathy and giving example by example and example and from this repertory only from the Kent or just from the Fatak mathematics and Fatak repertory, it is very well astonishing to me. And that time I learned that to go to the next level, you have to be very much firm in your basic and
And
foundation.
okay. Definitely,
Yeah.
definitely. And it is with every good homeopath, I feel. All good teachers, even if they are following certain method or certain thing, that is, I always say that if you like, if people ask about sensation, because I come from that school and I really like it. So they say, ma'am, that, array sensation, we didn't get that, we didn't get. I said, sensation is like MD or PhD. You have to do a PHMS first. So first you have to learn from the basic books, and then when your foundation is strong, you can go anywhere. You can follow any teacher or any method or any school. You will never go wrong, because that is based on very much foundation. Like, for example, sensation. How sir got sensation? But many people think that it is all airy and it doesn't have a foundation. But if you read his books, it's based on the repertory. He has just accumulated the common rubrics of the families, or row or something, and then on based on that, he has found that this is a common through and through sensation everywhere,
Yes.
whether it is in one row or one group or one family of plants. Then he will say, okay, this is written in proving symptom, that this is a repetitive symptom in all the remedies of the same family. That's why it is the sensation. And sensation is not a mental thing, it is a physical thing, experienced physically. So actually, that is not just a air castle, if
It,
you
it, is, it
understand rightly.
is like applying principle of grand
Grand
generalization
generalization, yes.
in the repertory, not in Mathematica. In the
Yes.
repertory, you get this, and I following Dr. Shankar says many times, and I used his method very in a different way. Many times we just like I went to if I will give one example that one day a patient came to me came to me with the warts on hands, palmar warts, so many warts, so many warts, so many warts, and I told him, what's happened? बोले, something like this, that done, and give me the remedy. Mm, If if you know your basic well, na, then what happened? The patient was not fitting to any remedy which I was thinking, not in Thuja, no Natrum, Anacardium, Dalkama. So what I should do? For like normal home pass, you give just Thuja, come to after Natrum, repeat doses. This will only maybe a palliative way or like this.
Yes.
Then I inquired him what happened to you. So for few months before, my uncle passed away with a heart attack, and he was in lap of me. I went, I went with him in the hospital, and he got severe heart attack, and he was dead at that time. So I got this shock, ekdam. So well, okay, this shock, and I was so much confused and like this. So I went to Dr. Shankar's schema, which I followed the most because I said that no, this is something different. So I went to Ambeliferi family, shock, where he given his Ambeliferi family, Magnolaceae and other family. I said Ignitia family also. So I found this Ambeliferi family shock, which is benumbing, blankness.
Yes.
What happened to you? बोला सर एकदम blank हो गया था, कुछ समझ में नहीं आया. And in psychotic miasm or anything said, it is conium is given there. I only asked him, do you tolerate milk? बोले no sir, ठीक है. I gave that remedy, gave that patient conium for this plantar warts. 200 single dose I had given. In the second second follow-up, the patient's 75% warts were gone.
Wow.
And the third follow-up, he never came. He just sending some patients. After 2 years, he came to me and said, sir, he gave me his hand, sir. बोले अरे सर चला गया पूरा. बोला आप आए नहीं. बोले सर खत्म हो गया, अब क्या आना आपके पास.
Yes.
So that's how we can use. Okay, whenever the things are not matching,
Yes.
don't try to squeeze them through the into the patients.
Yes.
Try different remedies.
Yes.
नहीं सर ये थूजा में नहीं आ रहा, ना नेट्रम कार्ड बैठ रहा, ना आर्ना कार्डियम, ना डलका मरा. Do we have any other options? Yes, we have other options, and this is correct. It is like MD or PhD. Whenever you learn that this is not thuja,
Yes. True.
this is not thuja.
Yeah, yeah. And we should learn all the tools. Similarly, I use Dr. Sarkar's method when something doesn't work for me. I am like, now I have to go. I have tried my own way and I've taken whole case, sat with it, but it is not working. Then I would definitely refer Sir's book and see what kind of organ remedy or, some allopathic remedy or something like that. And I ask him on phone and he says, beta, aisa kar lena. And then I feel like, oh, it is like, and he writes beautifully that okay, this is an allopathic remedy proved in homeopathy, and it is like lycopodium or it is like pulsatilla. So it's also a great way of looking at things that okay, it is not the same substance, but it has symptoms like that remedy. Like you said, it's not thuja, but the same psychotic miasm is there. So there is some commonality. So
Inovitex is better.
yes,
Inovitex
from other
is
family, yes.
family. Yes. This is how we are doing for the students who are basic, that don't go first. That's how you are started to revive the basic, that
Yes.
first go for the basics. There's first compare that this is thuja, this is not thuja, this is not lycopodium. Then go for this something bigger. This is the whole. I think this whole idea of yours is to revive, to make strong.
Yes,
with
foundation should be strong.
foundation. Is this foundation.
So thank you so much, Dr. Ranjan. It was a great discussion. I'm really grateful to you. And I would really like to learn more from you. So it's an open invitation whenever you have time. Please come again. We would be delighted and it would be our honor to have you again.
The honor is always mine to be associated with you, because we are following you since so many times, and we learn so much from you and Dr. Weber. And I'm very much honored to be in your platform. Thank you. Whenever you order me, I will be there. No.
Oh, it is a request. I can't order you. But now I'm going to bother you for sure.
No problem. It is always, the pleasure is all mine. Always.
Thank you. Thank you so much. And thank you everyone for joining in. I hope you enjoyed. In fact, I'm sure you must have enjoyed. So please share your learnings, your feedback. I'm going to post this video on YouTube as well. Few people were asking about the recording. So I'm going to post this so that it benefits you again and again. Whenever you want to hear it, whenever you want to learn something, go to the foundation. Please come back and listen to it. And if you have any questions, you can write to us on our email, ashahomeopathicacademy@gmail, or directly to our numbers. You already have it, and to Dr. Ranjan sir also. Thank you so much and have a great day ahead. And we'll see you soon in the next session. The next session is on 9th of Feb. And one of my very dear friend, Dr. Charu Vahan from Tamil Nadu, is going to come. And he's a great clinician. I have seen him working. He's a very composed, nice clinician, has a lot of knowledge about, about practice. So I'm really looking forward to that session as well. Thank you so much and have a great Sunday. Thank you, sir. Happy
Thank
Sunday
you
to
so
you
much.
too. Thank you.
Thank you.
Bye-bye.
Thank you.